Thank you for being here today. My name is Lisa Pack, and I'm here to talk to you a bit about Rett syndrome. Rett syndrome is a rare, non-inherited genetic postnatal neurological disorder that occurs almost exclusively in girls. It leads to severe impairments affecting nearly every aspect of that child's life, their ability to speak, walk, eat, and even breathe easily. Cognitive assessment in children with Rett syndrome is very complicated, but we know now that they understand far more than they can communicate to us. This has been proven by their bright and attentive eyes, their ability to express a wide spectrum of moods and emotions. Rett syndrome is caused by a mutation of the X chromosome, MECP2, also known as methyl CpG binding protein 2. It's a gene that encodes the protein, MECP2, and it appears to be essential for the normal function of nerve cells. The protein seems to be particularly important for mature nerve cells where it is present in high levels. The X chromosome, where MECP2 is found, controls the functions of many other genes. Rett syndrome primarily affects girls because, unlike boys who have XY chromosomes, girls have XX chromosomes. The second normal X gene ensures that at least some of the proteins are produced. That is why it is fatal for boys. Boys usually die very soon after birth, and young girls can live This condition affects an estimated 1 in 9,000 to 10,000 females. In more than 99% of the people with Rett syndrome, there's no history of the disorder in families. Many of these cases result from new mutations of the MECP2 gene. There has been, however, a few families with more than one affected member. These cases have been able to help researchers determine that classic Rett syndrome and variants caused by the MECP2 gene have an X-linked dominant pattern of inheritance. Conditions are considered X-linked if the mutated gene that causes the disorder is actually located on the X chromosome. The inheritance is dominant if one copy of the altered gene in each cell is sufficient enough to cause the condition. Though most males die in infancy, a small number with the genetic change involving MECP2 have developed signs and symptoms similar to those with Rett syndrome, including the intellect. Rett syndrome does not discriminate. It strikes all racial and ethnic backgrounds and occurs, as mentioned in the previous slide, worldwide at a rate of 1 in 10,000 births. Doctors issue a clinical diagnosis by observing signs and symptoms during the child's early growth and development. Ongoing evaluations of the child's neurological and physical statuses are conducted. A pediatric neurologist, clinical geneticist, and developmental pediatrician should be consulted early on. They will use clinical criteria and a specific set of guidelines to adhere to. The criteria is main, supportive, and exclusion. The presence of any of the exclusion criteria negates a diagnosis of Rett syndrome. There is no treatment for Rett syndrome. Treatment is primarily symptomatic and focuses on management of symptoms and support, which requires a multidisciplinary approach. Medications may be needed for breathing irregularities and for motor difficulties. Anticonvulsant drugs may be used to control the seizures. Scoliosis is also monitored closely, as well as heart abnormalities. Occupational therapy gets involved to help children develop skills needed for dressing, feeding, and arts and crafts. To prolong mobility, physical therapists use hydrotherapy. Some children require special equipments and aids to help them maintain, while nutritional programs keep them in adequate weight categories. Rett syndrome is commonly divided into 4 stages, and those afflicted can live well within middle age without serious complications when followed closely. The stages are as follows. Stage 1, early onset. Signs and symptoms are subtle and easily overlooked during this stage. It starts between 6 and 18 months of age and can last for a few months or up to a year. Babies in this stage may have less eye contact and begin losing interest in toys. Delays in sitting and crawling may be present. Stage 2, rapid deterioration. This stage begins at or around age 1 and 4 years of age. At this stage, children lose the ability to perform skills they previously had. This decline can be rapid or more gradual in process. The actual symptoms of Rett syndrome start to occur, such as abnormal hand movements, hyperventilating, screaming or crying for no apparent reasons, and problems with coordination. There is also a loss of social interaction and communication. Stage 3, plateau. The third stage usually takes place between the ages of 2 and 10 years old and can last for many, many years. Although problems with movement and coordination continue, behavior may have limited improvement. With less crying and irritability, some hand movements may improve with continued intervention. Seizures begin in this stage, but do not generally begin until after the age of 2 years old. Stage 4 is late motor deterioration. This stage begins after the age of 10 and can last for years or even decades. It's marked by reduced mobility, muscle weakness, joint contracting, and scoliosis. Understanding communication and hand skills generally remain stable or improve slightly, and then seizures start to appear less often. Common complications of Rett syndrome include sleep problems that cause sleep disruptions to the affected and the family members, difficulties eating, which lead to poor nutrition and delayed growth, bowel and bladder problems that cause constipation, reflux, incontinence, and gallbladder issues, pain relief from gastrointestinal issues, and bone fractures may also be needed. Muscle, bone, and joint problems follow. Some children have anxiety and behavior problems that hinder their social functioning. The need for lifelong care and assistance is an added issue that is all-encompassing. Those with Rett syndrome have shortened lifespans, although some live into middle age. They usually pass on due to heart problems and other complications that are health-related. Current data states there is no way, as of late, to prevent Rett syndrome. Public health researchers indicate Rett syndrome as an important contributor to the total burden of idiopathic mental retardation. There has been successful epidemiology studies of mental retardation that tells us that future studies will require large samples of homogeneous populations. Because Rett syndrome is homogeneous and common syndrome of idiopathic mental retardation, methods may be more productive in the research of Rett syndrome than in other syndromes that are less likely clinically homogeneous. There are many support services available, and these should be taken advantage of. Early access is the key to helping a child with Rett syndrome along developmentally. There is help with insurance navigation and gaining proper ancillary support. Supplemental income is also available to those with this diagnosis. Funding is available through philanthropic means like the Lions Club, Rotary Club, Make-A-Wish Foundation, and many more. Make-A-Wish and others help with medical appointments, therapies, equipment, transportation, housing modifications, and things that will help them in their daily life when needed. Just stay vigilant. There are many state and federal services, but reaching out is necessary to be proactive. What needs to be known about Rett syndrome is that they are smart, strong, and waiting bravely for us to unlock the door to their recovery. There is no cure, but researchers always say that it's curable. Research have proven that once they get protein levels back to normal, symptoms subside. The work being done on Rett syndrome will end up helping thousands of people worldwide. The findings have direct impact on autism, schizophrenia, bipolar disorder, Alzheimer's, and many more. These kids hold a key to the cure for millions of people suffering from varied disabilities. The bulk of funds raised are sent to Rett Syndrome Research Trust. They are confident that effective treatments and ultimately a cure will eventually come. Their confidence stems from scientific evidence. The fact that there is no degeneration in the brain sets this disorder apart from many other neurological diseases. The dramatic reversal of this disease's symptoms that has taken place in the lab with rats bring optimism and enthusiasm to families and also the research community. This research was quite personal to me, as a great friend's daughter has it. She was diagnosed with Rett syndrome at the age of 3 years old. Her name is Jasmine, and she has one of the best support systems by way of her mother that I've ever seen. Jasmine recently turned 30 years old and celebrated her birthday with a trip to Puerto Vallarta with her mom and grandmother. Once she returned, though, she ended up with a very short-lived sickness that hindered her breathing. After a cycle of antibiotics and a few doctor's visits, Jasmine's mother was told that she most likely had entered into stage 4 of her Rett syndrome diagnosis. Her pneumonia has cleared, breathing is now controlled, and she's back to her happy self once again. When Jasmine was approximately 9 years old, she was featured in the Discovery Health Channel documentary called Silent Angels. Her mother is very active in her health and research and offers information involving Jasmine to those who ask. Her doctors, public health professionals, researchers, and parents also help whenever they can. Her mom offers up this information about Jasmine because she knows that the information that she shares will result in new discoveries that will also help others, not just her daughter. She is hoping for a cure. She looks forward to the day.
She's snoring, Lisa.
To conclude, I've added a few photos of Jasmine just to make it a little more personal and see who I was speaking about. This is one picture of Jasmine and her mother in Mexico celebrating her 30th birthday. Top right corner is a screenshot of the documentary Silent Angels, and below is a video that her mom usually sends me to keep up with what's going on with her and when we're talking and discussing how Jasmine is doing. And it's just a small video of her at bedtime. Thank you for listening.